Hi, my name is Carlin Jones, and this is my final project titled Improving the Shared Decision-Making Process Prior to Surgical Intervention. So what is the shared decision-making theory? It involves a patient and healthcare provider who work together to make healthcare decisions that are best for the patient. It includes evidence-based information about the available options, the provider's knowledge and experience, and patient's values and preferences. The effects on patient outcomes include improved patient safety, increase in quality of life, and increase in overall patient experience. Some of the barriers to effective shared decision making can include health literacy, anxiety that the patient may have prior to the procedure, limited time to make the decision, lack of family support, and lack of resources. So why is shared decision making important? I found a couple statistics that I found pretty shocking and I wanted to share. So 64 million surgical procedures are performed each year in the US, and 100,000 deaths occur from complications such as heart attack, blood clots, and infections. 27% of inpatient stays involve one or more procedures. So these procedures are happening all the time, and it's so important that we have these conversations with our patients. 1 in 7 patients will regret even having the surgery, and 1 in 3 Medicare patients receive surgery in the last year of life. Now, this statistic highlights how many of these procedures were actually necessary or actually improved the patient's quality of life, given that they only had maybe another year or so left to live. Approximately 39% of patients even feel that they have a shared decision-making process during their consultation, and only 20% of information is retained during a preoperative consult. I also found a statistic that said that over $210 billion are spent on surgeries each year in the United States, and surgeries such as open heart surgery can cost a patient over $300,000. So not only can it cause, a decrease in quality of life potentially for certain patients, but also a major financial strain. So my intervention to improve the shared decision-making process includes creating educational videos to show the patient during the pre-op period. So this includes discussing what the procedure entails, showing animations of the actual procedure, such as the one I highlighted over on the right. So that, for instance, is a patient who has a brain mass, and they say, okay, this is what the procedure actually entails. And some patients may realize actually how invasive the procedure is, and they may decide that they don't actually want it. The video will also discuss recovery and aftercare, the risks and benefits of receiving or declining the procedure, and then also how it will affect their quality of life in the long term. So using shared decision making in practice. So again, it includes the clinician's judgment. So it's important to perform a thorough H&P, including the social determinants of health, such as their support, their income, their transportation, accessibility, etc. Also assessing the patient's knowledge of their condition, discussing the provider's knowledge and experience of the condition, describing the procedure in detail, discussing treatment options during the surgical consult. So saying, if we don't do this procedure, we also have these options available. And then also really discussing the risks of the procedure and their prognosis. So, how will this procedure improve their quality of life, given they may not have much longer to live, for instance, and should we even do this procedure? And then also including the best available evidence. So discuss potential outcomes, again, that can affect their quality of life, benefits and harm from the procedure, and the time horizon to benefit or recovery. And then really looking at the patient's values. So discussing how they feel surrounding the options for treatment and exploring their idea of quality of life. So after you finish the you finish the shared decision-making process, answering any questions or concerns they have, and allowing adequate time for the patient to make a decision if you're able to. And then if they decide that they do not want the procedure, it's important that you report that back to the surgical team as soon as possible. So how and why the procedure videos can assist with decision making. So they can be available by iPad or television. So if you're in the office setting, you can have an iPad available to show the patient the videos. It could even be available on their online platform so they can review the videos multiple times and share with their family. And then also in the inpatient setting, generally there are televisions in the room. So the patients may have those videos available to them while they're in the inpatient. So they can increase patient understanding. So showing the actual procedure can really give them an understanding of what they're going to be going through and really, help them to actually understand what procedure they're agreeing to. So also improving patient satisfaction. So these patients will feel more empowered to make a decision that aligns with their goals. And then improving patient outcomes, so a decrease in procedures that are unnecessary or not desired by the patient. And overall, the use of them can definitely improve the patient's quality of life. So in conclusion, the shared decision-making theory is an important aspect of patient care, enabling better communication between a patient and their healthcare provider during difficult healthcare decisions. The use of educational videos can be a helpful method of ensuring patient understanding of what their recommended procedure entails, along with the risks and benefits of the procedure. As a healthcare provider, it is paramount that we educate and support our patients in making these difficult decisions, as invasive procedures can potentially affect their quality of life and lead to poor outcomes. By creating a patient-centered approach to our care, empowering our patients to make informed decisions that align with their healthcare goals, we can increase patient satisfaction, decrease procedure regret, and improve their quality of life. These are my references. Thank you so much for watching.